Welcome back to this week's Desk Side Chat. Our topic for this week is incorporating health insurance into planning. Our featured guest is Eric Liek. Eric, thanks for joining us this week.
You, John. Nothing like health insurance on a Monday morning, right?
Oh, this couldn't get more exciting. I was telling Eric earlier that this was a topic that we had discussed before. And it's an interesting topic because it's not something that a lot of advisors are incorporating into their process. It certainly can be something if you think about holistic, comprehensive wealth management. It's something that's important to a lot of clients, health insurance. But before we get into this week's topic, Eric, if you could just provide us with a little background on yourself, and then we'll jump into it.
Yeah. So I started in the business back in 2008, August of 2008. Good timing. Worked back office, worked as an assistant for a while, and then became an advisor in 2012. And so as far as health insurance is concerned, the Affordable Care Act passed in 2010, and the major parts of it was 2013, 2014. So right as I'm, first couple of years as an advisor who came in with their project 200 of people to contact, that was really a project 100, and 80% of that was fluff. I needed to figure out, how am I going to have business? How am I going to survive, right? And so you start talking to people that you meet, and health insurance in our country had changed so much, so drastically, so quickly. You start asking, well, what are you doing for health insurance if you're recently retired or contract or whatever? And you start to find out that people have no idea what they're going to do. It's all new. They've heard things on the news, but they don't know what they're doing. So then you go, well, I guess we need to figure that out. And so you start figuring it out together. And then kind of from there said, well, if I'm going to help people with this, I may as well get appointed with these health insurance companies and get paid for it. It doesn't pay great on the exchange, but it's something, right? And so was doing that, here and there, helped build the business a little bit. In 2016, left Prudential and joined Next Level Planning and Wealth Management in Brookfield, Wisconsin. And so it's a big team, right? And so we have 10 plus advisors here. Our main focus at our company or our main source of business, other than natural markets and referrals, is to do financial education at companies. And so we're educating employees, and a big topic, of course, is health insurance. And given what's gone on over the last few years, you can imagine lots of people are looking to retire early. Anyone who's under 65, it's what are you going to do? How are you going to plan this out? And so it's been good for me being the local expert on pre-65 health insurance and helping other advisors in the office figure out what do you plan for? How do you project the prices of these plans? And then income planning is the big thing. Since all of your pre-65 health insurance is priced based on your income, what income counts, what doesn't, how do you show artificially low income until you hit 65, basically. And so it's kind of expanded from there that, I think somewhere around 60 or so households that we've got helping with health insurance there. And so there's a lot of help that you provide with that. And then I find out from talking to people too, that not everyone knows what they're talking about when it comes to health insurance. So there's kind of goes both ways. There's planners that don't know everything, or financial advisors that don't know everything. And then there's health insurance agents that don't know everything. So trying to basically bridge that gap and help people out with that. So I think it's been a really good service to existing clients. It's definitely helped kind of seal the deal with new clients, saying, well, I can help you with that. We can manage that income. We can plan that out once you hit 65. There's a few of us that help with Medicare insurance. So, we have that taken care of for you. And like every annuity company will tell you, the biggest concern is health insurance or healthcare costs in retirement. So how do you plan for that? And taking that concern off people's minds, makes the markets tanking not as big of a deal, makes all these other things not that scary because you've done that for them.
One of the big challenges that the industry has is defining what an advisor is to clients. Clients will still walk in and say, "Hey, are you a stockbroker? What's the best stock pick?" There's a lot of misinformation and just not a clear understanding of what an advisor can do. So how do you bring this topic up and really let clients know that this is part of that comprehensive plan that you can build for them?
Yeah, it's definitely not a focus of the business. It's not like we have signs up. We don't have commercials that can help you with your health insurance. That's not exactly, if I didn't have to do it, I wouldn't, basically. It's not my favorite part. Like I said, who doesn't want to talk about health insurance on Monday morning? It's kind of the same line I have for clients I'm meeting for the first time. Like, well, no better way to meet someone than to talk about health insurance first thing, right? But it's just kind of, you start to talk about it in any financial plan you're doing. It's a really big topic. It's a big part of it. So I don't know, you can't get through a financial plan presentation without discussing if it's an early retirement, even if it's 65 or later. Well, here's the projection of costs of Medicare plans, and factoring that in. So you have that conversation, and then people, of course, have questions about it. And then you say, well, don't worry about that. I can handle that for you. Or other advisors in our office can say, don't worry about that. We have people here that can walk through that. We'll factor in as close as we can to the plan projections. And then when we get to that point, we can help you do the application, go over which companies there are, what networks there are. And so it's just kind of natural, right? You have to talk about it if you're a financial planner. So you may as well get to know it. Yeah. So.
And in your case, you mentioned that you might as well be compensated. So are you actually selling the plans yourself? Are you partnering with outside agents? What does that process look like, Eric?
Yeah. So for me, I am contracted with the local health insurance companies, mostly around southeastern Wisconsin. That's our area, but really most of Wisconsin. You get kind of, I don't do it across state lines. It's not motivating enough. I'll help people out with, here's how you apply, here's how you factor income. So it's not like we just leave them hanging. I've helped people enroll in other states, just helping them do it. But in Wisconsin, I am appointed and do get compensated from the insurance companies.
And is that direct commission compensation? Do you work that into your fee, or how does that work, Eric?
It's a direct commission. So it's you have to go through, well, a couple of the companies will let you actually still do it direct. Some of them require you to go through a brokerage. So we have a local brokerage that we work with for contracting and going through. And they're a decent resource for some things, but really don't use them other than I need them for contracting.
And this is when you say local broker, this isn't under your broker dealer. So this is an outside business activity for you?
Correct. It is outside business. Yep.
So how would you again, I think this is an important topic. You mentioned the annuity companies. That's where my background comes from, and in the fear that clients have about running out of money, and how much health insurance, how much healthcare costs can impact draining savings. So bringing up this topic in some capacity is something that every advisor should be doing. Now, whether they take it to the full extent of helping and guiding clients in choosing plans, that's going to be up to each individual advisor. But if somebody is out there and looking to break into this, what advice would you have for an advisor who's looking to start maybe testing the water in basically providing this as more of a formal offering as part of their comprehensive planning?
I think in a perfect situation, you would have someone in your office to do it and that you don't have to do it directly. That way the information can get fed to you. You can still be an expert on it, but you don't have to do an annual certification on the marketplace. You don't have to keep up on the insurance companies and the network changes. Um, I mean, it seems a little easy for me to do. I mean, like any metro area, the health providers are some of the biggest employers. So you kind of get to know them a bit, right? And their benefits and what doctor areas there are. And every family has someone in healthcare. So my wife works in healthcare, my mother-in-law's in healthcare, other family. So kind of know the area and know the networks anyways. So it was pretty easy for me to pick that up. Um, I don't know that it's a tough one. I mean, to suggest breaking into it is tough, right? Especially if I think about if I was a solo advisor or even pretty small shop, even just a couple advisors, it's tough to say that you could have staff to do that because
But
it's time consuming.
no question, but it's something that it's like legal services, CPA services, PNC, all these things you could conceivably be part of a direct offering if you have the staff and capacity. But you also can act as a quarterback and dish those things off to outside experts in a variety of different areas. But if you were put yourself, I guess, if you don't mind for a moment, in the shoes of someone who a lot of the advisors who are involved in what we're doing are in that solo environment.
Right.
So I guess, given that, I mean, do you think it would make sense, Eric, in your mind that if they're not able to, hire somebody on staff, do you think a best first step would be to try to partner with an outside agent or something along those lines?
Probably. Like I mentioned, the brokers that we work with, there's some people there that are really well versed in these products. And they're friendly enough about it too, that I would assume if I was new to it and saying, I'm interested in this, if you're saying, well, I have people, I'm interested in learning about it, can we work together? I would assume that they certainly would. And that would be a good way of getting into it. I mean, in my opinion, Medicare business is easier. Now the annual certifications are more annoying and harder. But generally speaking, that business is easier. So that could be a first way of doing it. The pre-65 Affordable Care Act plans, it's the certification's pretty easy. I mean, I think the recertification took me a little over 10 minutes this year, whereas doing your AHIP every year is a good time commitment. That's a much harder test that you have to pass, even though it's mostly the same information, still seems to be a real pain. So I think if you could find someone to work with, that would be a good start. And that's kind of the thing that makes me nervous about this kind of business is if you aren't doing it yourself, making sure that you have someone you can trust to do it is a challenge. And I mean, if it's a health insurance agent who's only doing that business, I'm not really that afraid that they're going to steal business from me. It's just making sure that it gets done right. And with that, I'm much more concerned about the pre-65 on the Affordable Care Act, on the marketplace, getting that done right. Because the number of stories I have of, get a new lead and talk to her about it and say, well, that's not right. And send me your tax return. Like, well, you didn't claim all the credits you're owed. The last health insurance agent did not know what they were talking about. That's the wrong income to count. You should amend your taxes. Good luck with that. But, here's the right answer and I'll help you going forward. Or, someone who's freshly retired, helping them with it. And they say, let me ask you a question. My advisor's telling me that I should do Roth conversions. Do you think that's a good idea? It's like, well, I don't know everything about you because you didn't move all your money to me. We haven't done a financial plan. I'm just doing health insurance. But if we talk about it and you look at, a Roth conversion is taxable. So here's your tax rate and it's low, right? You're in that 12% bracket, it's a good time to do conversions before you do that. But here's how much credits you would lose on the marketplace for that amount of income. So it was essentially another 10+%, you could say, cost of doing Roth conversion. So it's like, well, I probably wouldn't do that. Maybe you should wait until you're 65, do conversions between 65 and 72, rather than in your low 60s when you're getting pretty cheap health insurance with pretty good coverage because you can show lower income. So the stories like that, it's like, well, that advisor is not doing planning, obviously. And then if he is, he's not doing it right. So yeah, there's stories both ways, right? That health insurance agents aren't giving good tax advice, and then advisors aren't either. So that stuff all makes me nervous, which is also a reason not to do this stuff, right? Like that's, why not have a PNC person in your office? Well, because when rates go up, claims go bad, and that client becomes dissatisfied with that, maybe they become just dissatisfied with your firm, and that revenue is not as big as other revenue streams. So, why do that? So it's kind of always been my concern about it too. I can't stop health insurance companies from being health insurance companies. So their billing issues, or they're denying claims or changing their formulary, I can't control that. So that's, but in this case, it's so much help to people that it outweighs those risks. So I have not had those issues.
I mean, it's differentiation. It's increasing the value of what you're delivering to the clients. As you mentioned in the beginning, it's something that maybe you're not wearing on your sleeve, advertising on all the walls, but it's something that could solidify the relationship with the client. And something that we got into previously when we were exploring this topic, and same could be said, PNC and accounting services as well, is there's a risk that those organizations or whoever a client might be going out to, if you don't find somebody you trust and could potentially work with, they may have the resources directly to manage money or another referral resource, and you have the risk of potentially losing a client if you're not working, either doing these things directly or working with somebody you trust. So I guess all those things wrapped up, what would you say would be it sounds like it's not necessarily compensation, but what would you say, Eric, is the biggest benefit to having this as part of your individual offering?
The biggest benefit is the client satisfaction. Those clients that we help with health insurance are, stickier clients than others, because it's a service that others are not offering. They didn't expect to get help with that. The amount of help they get is huge. So that's the biggest benefit, I think. I mean, you're right. I'm the first one to say the compensation is not the best, but the amount of happy emails we've received from other advisors or from my clients about the help that we've provided for that, the amount of referrals I get because of that business is more than from financial planning or investment management. I've gotten accounts because of the health insurance help that I've provided over the years. So it has built other lines. And those clients, again, are extremely happy, and more happy than clients that we're not helping with that. So that's definitely the biggest thing.
Well, and it's, maybe not the direct compensation, but that really ties into what we're trying to do with this cause. Good advisors finish first. Finish first means different things to different advisors, but compensation for most is certainly part of it. And if you're providing, an excellent level of service, really truly doing what's best for the client, the compensation will come. And it's something that advisors should not feel obligated to apologize for, right? If you're delivering an exceptional level of service, then, ideally you will have the entire share wallet for that client, and maybe up and down the parents and kids, the succession planning, referrals, as you mentioned. You do it right, and it can lead, ideally, right, it's going to lead to significant compensation. It doesn't necessarily have to be direct.
Absolutely.
All right. Well, we will continue the dialogue on this topic during the week. And it's something that I think we will continue to touch on as we move forward. Again, it's not something that a lot of advisors are doing directly, but it is certainly an important topic. It's something that is definitely on the minds of many pre and post retirees. So, Eric, thank you so much for joining us this week and sharing your insight. We really appreciate it.
Yeah, you're welcome. Thanks for having me, John.
On my